The aim of the EFFPAC study was to look at the efficacy and safety of the novel Luminor paclitaxel coated balloon as compared to POBA as control group. So this trial was performed as a randomized controlled trial. Well, one might say another typical paclitaxel coated balloon on the market, but actually there's something special about the coating. It's not only that it has a different excipient, which is lipophilic like many others, but what makes it special is the coating technique. So they used a special ultrasonic guided technique to coat this balloon surface, which with several layers on each other, which makes it quite rigid in terms of traveling through the vessel, through the sheath, and brings then the full coating to the target lesion. Well, the key findings at the 12 months was actually the typical, for such trials, typical outcome parameters like late lumen loss as primary endpoint, which was very low for us as investigators. We already were very surprised that it works technically very well. And this shows that it works technically very well. And in addition, we had the outcome parameters for efficacy, like patency rate above 90% at 12 months, which is also outstanding for trials in this field of the superficial femoral artery. And the TLR rate was really surprising. We only observed in the experimental group, in the Luminor group, only one case of TLR, which means or ends up in a fantastic TLR rate of 98.7%. So this was not reached by any other trial so far. But this is not even enough. This balloon actually was one of the first who could show clinical benefit, a clear clinical benefit by change of Rutherford. What does it mean, change of Rutherford? This means that the patient can really walk better. We are talking about claudicants, and this clinical benefit should be quite obvious if you apply a new balloon, but actually all other trials did not, most of the other trials, there was only one other trial who was able to show that, actually did not have any significant difference in terms of change of Rutherford to the control group. Of course, to baseline, it's clear, everyone expects that, but to the control group, so we really have one of the first balloons who really brings a clinical benefit to the patient. We have to be careful with comparing one study with another. Especially, it was not a study performed as head-to-head comparison. It was a comparison of an investigational product, Luminor, against POBA. So, but still, if you look at the latest trials, which were done in a very comparable way, such as, for example, StellarX or Ranger trial, you will find you can really directly compare our results. The only difference is often then the lesion lengths, but the study design, like vessel preparation in the new trials, is really very much comparable. And in addition, if you look at older trials, they have differences between their experimental group and the control group. So the control group usually is POBA, and this is often not really prepared. The vessel preparation is not performed the same way as in the experimental group, which then often ends up with significant results compared to POBA, but in reality the clinical effect is not that much good. So for our trial, EFFPAC could really demonstrate that the control group was so strong already that it reached the values in terms of TLR and patency of most other trials. So some might think then, well, are the other trials now comparing with placebo, because actually if our control group is stronger than the experimental group or the investigational group of other trials with their products, it's really astonishing. So I think it's always very important to perform a trial quite thorough. So, and to really look and that both arms, the experimental arm as well as the control arm, which is POBA, is really performed in the same fashion. And we learned from our trial that vessel preparation is really, really crucial for the outcome.